My name is Sharon Kelly, and I love being a nurse because I can remember as a little girl that inner feeling that I wasn't sure what it was of caring for people. I grew up in the church, and everyone has that supportive base, always willing to help one another. And so, with that in school, I continued to develop those feelings and seeing different students that were struggling. I can remember an incident on my school bus where one of the kids had a seizure at the back of the bus. And so while everyone was laughing or scared, I just wanted to help him. How can I help him in this moment of need? And so that is what drove me to that compassion of help. And that is one of the most valuable strengths you can have in nursing.
Well, in a word, teaching is exciting. I became a nurse mainly because I wanted to help people. That's why a lot of people want to do that. But also because I knew it had lots of opportunities for me. I knew that nursing was a path where I could step off and venture into a lot of things. And as a result, I did. I joined the Air Force. I traveled. I got to do so many things that I really couldn't have done initially in the healthcare field, but being in the military helped me to expand and explore my horizons and to try a variety of different things and to learn things, not only just from nursing, but from nursing administration and education, and also venture into the world of leadership.
Hello, everyone. I'm Dr. Jatonna Benton-Lee. I'm a nursing professor at Northern Kentucky University. I've been a nurse for almost 20 years, and this is my second profession. I was a teacher at a university where I taught business administration, but I wanted to make a better connection with people. I wanted to be able to serve people, to help people, to see people get better. And so I went back to school and did a second degree program in nursing, and I have loved it ever since. I have been on a wild ride. I have been an ICU nurse. I have been a trauma nurse. I have been a surgical nurse. I have done lots of different jobs in nursing, and that is the beauty of nursing, because there's not one clear pathway. A lot of people think that you have to work at the bedside, but you don't necessarily. Right now, I work at a university teaching students, but I'm also studying to become a nurse scientist so that I can do research in communities and impact population health.
To me, in order to maximize our patient outcomes, research has shown that patients who identify with the ones that are taking care of them build a stronger rapport and trust system with those individuals. And for healthcare workers, that relationship will allow us to understand our patient's needs better. It will help us reach what the patient wants out of their healthcare, and also it will help us get them there because we have a better understanding, we have a better trust relationship. They'll open up more, and then that will allow us to educate them, and then together we can collaborate to get them to where they need to do to meet their patient goals, meet our patient goals, and most of all, meet their needs.
Right now, my biggest passion has been on health equity. And if you don't know what that term means, it means making sure that everyone has equal and equitable access to health care. So regardless of who you love, what you believe, who you pray to, or what you look like, you have access to health care.
Well, we know from lots of research that healthcare needs to be available and accessible to all peoples. And over the years, that has not been, has not happened. In all honesty, it just hasn't been something that has happened. So by opening the doors and encouraging people of color, people from various backgrounds, various religious backgrounds, countries, whatever, to come and to go into the field of healthcare. We bring more of a blend of information. We don't treat everybody as stovepipe. We look at them as the total picture. That's what nursing is about. Nursing likes to look at the patient, the total patient, and not to categorize patients based on one particular set of standards. I am different, you're going to be different just by virtue of the fact that I'm a female and I'm an African American, but my requirements are going to be different, say, from maybe an individual who is a white American female. So we need to have that aspect of education taught in our nursing programs or in all of our allied health programs. That's what diversity is all about. It's about making us be good, feel good, and do those things that are going to benefit us as human beings.